Hi, I'm John Fredericks, the John Fredericks Radio Show, and this is my video update. Thanks for joining us today. Good news for America today is the Institute for Health Metrics and Evaluation, the closely watched University of Washington study, updated its coronavirus model again. The projection of total COVID-19 related deaths is now 60,000 versus the up to 250,000 they projected just 5 days ago. And hospitalizations fell from 150,000 to 90,000, a one-third reduction. The peak is now projected to be in the U.S. in 3 days, which incidentally is Saturday, one day ahead of President Trump's aspirational holiday Easter projection of just a few weeks ago. Meantime, Dr. Anthony Fauci, the nation's new Grim Reaper, who apparently wants to shut the economy down until 2021, had to relent today that his modeling was flawed as well, and admitted that his projections were off and U.S. COVID-19 deaths would be way down. Thank goodness for that. New York Governor Andrew Cuomo said in his press conference today, all these projections turned out to be wrong. But Dr. Fauci was quick to emphasize that now is not the time to ease up on social distancing measures because he says the shutdown is working. But the predictive models, well, they were based on the shutdown being in place. Therein lies the flaw, ladies and gentlemen, with this analysis. If things improve, the experts say it's because of the economic shutdown. And if we let the greatest economy in the history of the earth start producing again, well, more people will die or be imperiled. Yet they have no evidence to support any of this. We're destroying millions and millions of lives and families on an econometric medical model with no real evidence that shutting down the economy and destroying 30 million American jobs is helping to do anything but kill even more Americans unrelated to catching the virus. While the fake news spews this out as gospel, there's no metric they ever mention. It's always open-ended. What's the number of beds that flatten the curve? What's the percentage of ventilators we need? What's the number of ICU beds we need? What do we need in order to get Americans to go back to work and save their jobs and their country? They will never give you a number because they don't have one. And when they do have a yardstick, they move the goalpost. First, it was the number of beds we need not to overrun our healthcare system. Now, it's the number of people dying. Tomorrow, it'll be the number of tests we need. The only number they ever gave us is when Dr. Fauci said the number to open the economy is 0. Well, that's absurd. On the other hand, shutting down the economy has real metrics. 10 million people have filed for unemployment in the United States in the past 2 weeks. Another 20 million is coming in the next 2 weeks. 3 million small businesses have already shuttered. Their companies gone, with over 3 million dreams shattered. Lost wage earning power will take 2 decades to recoup. Families disintegrating, savings depleted, depression, anxiety, alcoholism, drug overdose, domestic violence, heart attacks, strokes, and suicides. All of these are measurable numbers. American business and families can survive to April 30th. We need our country to open back up on May 1st for business. We need President Trump to allow us to go back to work May 1st. I'm John Fredericks. Thanks for being here. I'll be on tomorrow, 6 to 10 a.m. Thanks for being with us.